to the second installment in our candidates forum for candidates for the State House in Colorado for 2016-17. We have, as you can count as well as I can, 8 candidates tonight. So we have a well-represented field of prospective representatives for our state. I wanted to thank a few people first before we get started tonight, and then we'll go over some ground rules as to how we want to manage the presentations. I want to thank our sponsors. First of all, my organization. I'm chair of the board of Mental Health Colorado. My name is Charles Ryman. Our other sponsors are the National Alliance on Mental Illness, NAMI, which you're all familiar with, Colorado Advanced Practice Psychiatric Nurses, Colorado Providers Association, the Colorado Psychiatric Society, Colorado Psychological Association, and Rocky Mountain Crisis Partners. Those are the partner organizations that helped put these events together in cooperation with our extraordinary staff at Mental Health Colorado, some of whom are in attendance tonight. Andrew Romanoff is not here. He's our president and CEO. Mo Keller is our vice president of public policy and strategic initiatives. Most of you know Mo. There she is. Ruben Nanez is our operations manager. So he is the technical guru behind all the sights and sounds that we're going to be experiencing, hopefully with no glitches tonight. Ruben, thanks so much for your work. Emily Elder is our public interest fellow extraordinaire from Colorado College. She is the driving force behind these forums. So we couldn't have made these forums go without Emily's help. And Susan Roger, who is a volunteer, is helping us as well in these forums. And Linda. Thank you, Linda. They didn't put your name on here, Linda. Who's responsible? Who's the guilty party? Who didn't? All right. So a little bit about our ground rules for our candidates tonight. Our candidates have been given a list of questions to review beforehand because we didn't want to get into a situation where we asked them highly technical questions on the spur of the moment and ask them to give an answer in 1 minute. So they do have time to prepare for the questions that we provided to them beforehand. However, to keep them all alert and on their toes, we have some questions that have been submitted online, which they have not seen. And we also will open it up for questions from our audience as time permits. I also have questions that have been written out on index cards. So that will be the more spontaneous part of the night to keep everybody ready to go. So if that's all right with you all, we will go ahead and get started with our first question. Each candidate will hear the question. They will have 1 minute to answer. We have 8 candidates, so Emily has told me we have to maintain our time very strictly, so we will do that. So I don't mean to be rude in cutting you off, but I will cut you off after roughly, give or take a few seconds, 1 minute. So our first question tonight, and we'll go from right to left. So we're going to start with Mike Weissman. As we go through this first battery of questions, if you would, at the beginning of your answer, just introduce yourselves very quickly and what you're running for, and then get into your answer. So Mike, most of the Coloradans we've talked to tell us that cost is the single biggest barrier to mental health care. How would you make mental health care more affordable in the state of Colorado? You're good.
Good. Mike Weissman, candidate House District 36, which is East Aurora. As to cost narrowly, I think the answer needs to begin with the reality that in mental health care, as in healthcare more broadly, most people access care through insurance. So I think if we have cost issues, that means that we have insurance issues, be it rate of reimbursement, maybe particularly for Medicaid, in and out of network provider questions, maybe particularly with Medicaid, maybe particularly with exchange plans where we've seen the news that those plans may start to experience some rate hikes. So I think we need to look very closely and carefully at the way in which insurance provides coverage for healthcare services. I think more broadly, for just a second, beyond cost, we have this dichotomy of mind and body, which is as old as Western philosophy. And I think we've closed that even in the last couple of decades. And in my lifetime, we're coming to a better understanding of how linked these two realities are. But I think we have a long way to go yet. And further, I think this issue really connects to a lot of other public policy issues that all of us would potentially be dealing with in terms of homelessness, in terms of potential, low-level criminal behavior, if there's actually a mental health cause driving things. And finally, I think hopefully this would be one of those areas where solutions need not be as partisan as some things are these days, because the reality is that most of us probably have a connection to this issue in some way through friends or family. I mean, I have a cousin who's been struggling, and we probably all have a story that we could share.
Indeed.
Good evening. Thank you. Good evening. I'm State Representative Janet Buckner, House District 40, which is Southeast Aurora. I am the current state representative, but I'm running for re-election as I was unanimously chosen by a vacancy committee when my husband passed away last year. The question is interesting. I'm on Health Insurance and Environment Committee currently at the House of Representatives. And my belief is if insurance plans could provide mental health care options, that would be a good beginning if that was an option. I believe in collaboration, and I would meet with all the representatives of all the different health plans and evaluate reimbursements so we know realistically what can be done, and discuss those reimbursement rates and discuss how to increase access, because if we increase access, that's really what we should be striving for. Just from what I know from being in healthcare for over 3 decades, it's a very complicated issue, and there isn't one narrow solution. It has to be a collaboration, and by collaborating, hopefully we can come to a good end.
Do you hold out the same hope that Mike does, that cost doesn't necessarily need to be a partisan issue?
Does not have to be a partisan issue. Yes, I agree with him.
Good. This is a hopeful note for us to start with tonight.
Well, it really is. And from my background and collaborating with people, if you keep bumping heads, you're not going to get anywhere.
Yeah.
So I really believe that we do need to work together and reach across the aisle.
Thank
Yes.
you. Jovan.
Thank you so much. My name is Jovan Melton. I'm the state representative for House District 41. I've served in the House for 4 years now, and I'm really glad to see you all here in Aurora and interested in this very important topic. Thank you, Charles. Thank you, Emily. Thank you, Mo, for hosting this tonight. To answer the question, I definitely agree with what you've just heard, but to take it also a step further, I think that we've also got an opportunity at the state level to really try to get more involved with our community providers. For instance, like here in Aurora, we have Mental Health Aurora, which gets quite a bit of funding from the city. And unfortunately, the city pays for that through some of the red light programs and different things where they have to creatively find funding models. I think the state should take a larger burden in terms of helping fund some of our community providers, so that way it increases access and decreases costs. I also definitely agree with the reimbursements, trying to, one, make this much more accessible for reimbursement, as well as speeding up the reimbursement, because so often, especially with Medicaid reimbursements, the reimbursement time is so delayed that many providers are willing to offer the service, but not willing to wait as long as it takes for the state to cut them a check. And so I think that there are some mechanical issues that we can do on a state level, as well as, again, investing state resources towards community service project or community programs.
Wonderful. Thank you. Dominique.
Hi, everybody. My name is Dominique Jackson. I am running for the Colorado House of Representatives in House District 42. Welcome to what will hopefully be my district. So, you know, I'm certainly going to reiterate some of the things that some of my colleagues have said. Yes, reimbursement. Yes, access, insurance coverage. But I think that there's some other broader issues as well that we also ought to pay attention to, particularly when it comes to shortages. Shortages in the number of practitioners that are available to treat patients. Shortages in the number of facilities that are out there to treat patients. Cost is very prohibitive, particularly when we treat patients in emergency rooms, certainly when we treat patients in jails and in other facilities in which they're not going to get the kind of quality of care, and we as taxpayers are paying a premium on that kind of care. So those would be the kinds of areas that I would prefer to look at. And yes, I certainly agree with Representative Melton that the state does need to take a broader role in all of this. We are doing great things here in Aurora, but our state as a whole, mental health is an incredibly huge and complex issue. And as many of my colleagues have said, it affects every single solitary one of us in one way, shape, or form. And it's something that we all need to step to the table to help to take care of. Thanks.
Thank you, Dominique. Nancy.
Good evening. I'm State Senator Nancy Todd, represent State or Senate District 28, and I've served in the House for 8 years and in the Senate for 4, and now I'm up for re-election for my final 4 term. I think a couple of thoughts come to my mind. Number one, we have had such a blockage for people to recognize what mental health is and to not be embarrassed to seek out help. And I think that oftentimes has become a block and a way of getting help for people. Integrative care between the physician and mental health services, I think, is probably one of the greatest ways that people can receive the care that they need, and to be able to start in and be able to give them that opportunity to, number one, have a relationship with the doctor that they're going to see. Because oftentimes it may be a matter of depression. It may be a matter of something that is a temporary situation for them, but it is frightening in many cases for someone to seek out and say, I have some mental health issues. And so by bridging that, by making that in a more comfortable setting, I think is really important. I think our community mental health right here in Aurora is phenomenal. The outreach and the accessibility of being able to walk in to a clinic and receive help and receive care is non-threatening and very open. And I think that is one of the most important things. At the state level, I can remember back 12 years ago where we really did not have the parity for mental health services that we do today. So we've made great gains, but we certainly have a lot further to go. So affordability is always an issue. I agree with what everyone has said. This is a nonpartisan issue. It is about helping people get the help and the care that they need, and making sure that we are standing firm in leaving those doors open and those opportunities for help in emergencies. And I would also just add the importance of working with our law enforcement as well.
Excellent. Thank you.
My name is James Woodley. I'm running for State Senate in District 28. I do believe that this is a nonpartisan issue, and I think everyone here at the table will agree with that. Mental health issues are very important to me. As a veteran, I have a lot of brothers who suffer from PTSD, and some of them have even gone as far as to commit suicide. And 11 veterans a day commit suicide. So it is a major issue, especially here in Colorado, where we're such a strong veteran state. Now, as it was already mentioned, healthcare and the cost of healthcare is a very complex issue. But what I think we need to do is we need to look for rational solutions. And one of the problems that we run into is here at a state level, our hands are tied by the federal level. So it becomes a matter of what can we do to work within a system that's already broken. And I think that if we look at the problem at the source and find out what's really causing the issues, then we're able to attack the problem and we're able to fix it. And I think that one of the number one issues of the cost of healthcare is the fact that the consumer doesn't see the cost of healthcare. So what we end up having is a society in which we are over-medicating. We're using healthcare services more than we necessarily need. And what that's doing, it's driving up the cost of healthcare. And those that suffer the most are those who need it the most, those who come from low income or those who suffer from mental illness. So that needs to be addressed. And then the other issue, and this is an issue that I may not be popular on, is the cost of pharmaceuticals and medical devices. This is one of the largest costs of healthcare. And I'm a proponent for open and free market, but I don't believe in profiteering. And I don't believe that those should profit from the people who are at their mercy. So I am open to looking at the idea of seeing what the state can do to place caps on pharmaceuticals as well as medical devices.
And that'll need to be the last word. Thank you.
And that's the
Thank
last
you.
word.
Thank you. Rhonda.
Good evening. I'm State Representative Rhonda Fields. I represent House District 42. I'm also a candidate for Senate District 29. And when I think about the cost of mental health services, I'm really excited that President Barack Obama passed the Affordable Health Care Act, which includes mental health services. And so when you think about now that is being an opportunity for people to get services through insurance, and this was historic that we were able to pass that. And of course, that makes it much more accessible. But I think to make it much more accessible and affordable, we need to think about the scope of practice. When you think about who is providing mental health services, I think we need to look at social workers because they can also provide some support for people who are having behavioral issues, or perhaps you can get some help from nurses. They can also provide services, but the way we do fee for service, sometimes those issues aren't eligible for payment. So we need to look at how we can include some of these other scope of practices to get resources to people that might have a need. If you look at psychiatry, that's one of the highest level of paid services that you can get. And there's other people that can be providing services like psychologists and those kinds of things, which would be greater access for people who have the need. So I think that's what we need to do, as well as take away any stigma that's associated with seeking out treatment. We know that a lot of folks are walking around ill and have not been treated or diagnosed. And I think a lot of that can be intervened in schools, in the classroom, with early intervention would be a great way to get treatment early and not waiting until someone is adult and they find out that they have some behavioral issues.
Well, thank you.
Sebastian Chunn, District 29 as well. Having to go up against this lovely young lady, it's tough to follow up, but I think I'm going to drive the hammer home with this and say, look, it shouldn't be a partisan issue. We need to work on solutions. Mental health is public health. It's public safety. It's so many different things, and we have to come up with solutions. Right now, we come up with partisan bickering. I'm tired of that. It's one of the reasons why I'm running, because you get in there and it's either a right issue or it's a left issue. And if it comes from, let's say if I was in there right now and it came from Rhonda, somebody would say if I was in there and we were both in there, right? They would say, if I agreed with you, oh, I'm a terrible person. Or if I came up with something and you agreed with me, oh, you're not doing what's right. We've got to stop that. And healthcare cost overall is just too expensive. It's not just mental health. It's too expensive. We need to look at it at the state level and say, what can we do? Whether that's opening up state lines, just like large corporations are able to do, stopping some of this antitrust malarkey, if you will, that allows insurance companies to get away with this. And then we need to make sure that mental health and every aspect is covered, because I know what it can do. I have an uncle of mine who suffers from bipolar disorder, and I saw what it did. It destroyed his life. It destroyed 2 marriages. It destroyed a very successful, thriving business. And I know people of Aurora know exactly what this has done too. It's destroyed our community, and it's caused lots of harm. So we do need to break that stigma. We need to get people the help they need. We need to find a way to lower costs. I don't care who comes up with the solutions. I just want to see solutions.
Right. Thank you very much. Let me interject here before we get to our next round of questions by letting our candidates know they've already spoken that we have media in attendance. We have the editor and publisher of the Aurora Sentinel is here, Jeremy Johnson. And would you identify yourself, sir? Terrific. In addition to that, we are live streaming this event through Mental Health Colorado. That will be posted on our website for the foreseeable future as well. So in addition to the lovely audience that we have here tonight, we'll have tens of thousands of more people viewing your performance tonight and in the days that follow. So I thought it was a wonderful moment of bipartisanship to hear you all talk about the fact that funding is not a partisan issue, especially when it comes to healthcare and especially when it comes to this avenue of healthcare, mental health. You all know by now that the state is facing a budget shortfall, an anticipated budget shortfall in 2017, ranging anywhere from $220 million, according to the governor's budget office, to $340 million, according to more independent economists. When we talk about funding for mental health care services, it seems as if the partisan divide does occur. People believe that mental health services are funded adequately, and to continue that, we need to cut waste, fraud, and abuse, but the budget numbers are okay. There's another point of view that says, no, we need to increase those budget numbers if we're going to adequately meet the mental health needs of the citizens of Colorado. So rather than going down the line here, I'll ask any one of you to jump in on that question and tell us where you fall on that spectrum, and keep in mind the background issue of Tabor. So who'd like to weigh in on that? Good luck. Yes, Nancy.
Would you like a mic?
Yes, yes.
Senator Nancy Todd, I think one of the most important things is when we start talking about budget shortfall and how we're going to address that is looking at our priorities. Public safety, I think, as Sebastian mentioned at the beginning, is one of our top priorities for the Capitol. And I think when we talk about that, we can't talk about that without addressing mental health. I think that those are things that when we look at the prison population, for example, making sure that mental health services are provided. When we look at our schools, K-12, early childhood, higher ed, public safety, once again, school safety is a top priority. And again, we do have more consensus on that Capitol than what the public thinks. So when we come back to looking at the beginning of November, when JDC starts meeting and looking at what the governor proposes and what all of the different departments come for, I think we are going to continue to see mental health at the forefront. Because if you have mentally healthy people who are provided and given services, they are able to live a fuller life. They are able to be functional, be able to work, be able to be responsible for their own actions. When you have people who are not well taken care of. So I think that's something that when we look at it from an economic standpoint, or whether we look at it as a social standpoint, we are really looking at it in a much more comprehensive way.
Okay. Someone else care to weigh in on that, Jovan? Is the mic off?
I didn't look to my left.
It's a small room. Did everybody hear Representative Todd's answer? Good, good.
It was on. I can agree with Senator Todd anymore. It's about priorities. And when we're looking at the budget, we've got to look at areas where there's waste. And I think one of the first areas that we look at is corrections. We spend nearly dollar for dollar in corrections as we do for higher ed education. And corrections has now actually become our highest or our largest mental health provider. That's got to change. We've got to flip that back right side up, because right now it's upside down. And we are seeing waste. Last year in the budget, there was $3 million that went towards one private prison in Burlington to stay open, although that prison was empty. That prison was, the inmates were being transferred. We were housing inmates from another state. They were being transferred back to that state. And in order to not lose that contract with that private prison, we decided to go ahead and fund an empty prison for profit. We've got to look at these things and say, we can cut the waste here. We can take that $3 million, invest it into vital services like mental health providers, and continue to help our population instead of just allowing these companies to use state dollars for their own benefit.
Someone else care to weigh in? Sebastian, down that end.
Yeah, so I mean, the $3 million, that's ridiculous. Waste, fraud, and abuse is obviously one thing. I think we have a problem right now is I'm a business owner, so I see a lot of businesses that get state funded or state money because they asked for whatever reason. Problem we have is right now they're not turning in receipts. They're not showing what it is. There's no accountability on that end. We have so much bickering back and forth from that. So we see a lot of businesses that get state money that go to paying for vacations and stuff like that. I think we need to start creating an accountability in that can save us a ton of money and use that money. And any time that these businesses or any department uses money that they said it was going to go to this and it doesn't go to that, we need to fine them. And then I think it would be a smart idea to put that money from the fines. It won't be near enough. There will never be enough money for this issue, but put that money towards going to state provided mental health.
Right. Rhonda?
Yeah, I think it's already, I think it's already been stated. I think that it's how you prioritize your spending and what you want to invest in. Down at the State House, we have to be really careful and strategic about how we spend our money and what we want to invest in. And Representative Melton said it right. I think that we overspend as relates to the Department of Correction. And I believe that we should be working upstream to prevent a lot of these issues that you see happen with crime. I think we can be doing more crime prevention kinds of things. We should have kindergarten across our state. We need to make sure that our kids are learning what they need to be productive, contributing members of society. And so we need to be investing upstream, and that includes mental health.
So to kind of summarize, is it safe to say that if you are honored by being elected to your positions, you would support a highest priority for mental health funding in the state of Colorado? Is everyone in agreement with that? For the record?
Absolutely.
For the record.
I would start with education.
Okay. I said a top priority. I didn't say the top priority. We want a lot. We don't need it all, but we want a lot.
Is this like on an airline that we need to verbally give you an answer?
I prefer the verbal answer.
Okay.
So does our live stream audience. All right, let me return to the scripted part of the evening. In most cases of mental illness, symptoms appear during adolescence, to Rhonda's point, and even before. But there are often long gaps, sometimes decades, between the first onset of symptoms and when people seek and receive treatment. What steps would you take to fill those gaps? And where's the microphone? We'll start with Rhonda and we'll come back this way. Sebastian, you'll be last this time around. Okay.
Well, I think that what we need to do is to treat the whole child. I sponsored a bill this past session was to address students that are in crisis. And I see teachers as being the front line person as it relates to mental health. I mean, they see these kids every day and they know a kid when they're depressed or they're seeing signs that need intervention. I don't think teachers should be treating, but I think that they can refer and they can redirect and making sure that we're getting kids the services that they need versus getting suspended or getting expelled. So when I say treat the whole child, then that means if a child has a doctor and the doctor has some issues or they're seeing the patient, then they should provide, maybe a social worker needs to be there. I think there needs to be more integrated care with treating anyone. So it's just not the adolescents, it's adults too, that we need to make sure that we have a collaborative approach. Now, I run a clinic, 1445 Dayton Street. And at that clinic, we have a collaborative integrative care, which means you just don't see the primary care. You also see a social worker. So you're seeing a variety of different folks so they can treat the person and make sure that person is on a pathway to health.
Thank you.
Well, I'm not a medical professional, and I think we get into trouble when legislators start playing medical professionals. What I do believe is that a legislator's job is to listen to the experts and find solutions that best fit the problem. A legislator should listen to those experts and see if those that are advising solutions that fit in the role of government. And if they fit in the role of government, then to find out how we can fund it and whether the state can afford it. And mental health is a top priority. It's a top priority for me. And I definitely would listen to the medical professionals on what they advise to fix this problem and make sure that we can find funding for it.
So James, I take by that answer, your door will always be open to Mental Health Colorado.
Oh, absolutely.
Good, good
Absolutely.
to hear.
And all your
Good.
partners.
Great. Nancy.
Thank you. Well, I'm thinking in terms of adolescence that any of us that have had children that have gone through adolescence, we all know and understand that day by day, moment by moment, our children change. They start as one person in the morning, and when they come home at the end of the day, they might be very different. So there's that is in the normal realm. And then when you look at the adolescent that is going through some mental health challenges, I think that's one of the things that, again, as a former middle school teacher, looking at that outreach, making sure that there is a follow-up to say, you know, I'm concerned. First thing is to bring in parents, have those conversations. We have things called Child Find, to where there is an integration of working with that child, making sure that those records stay with him or her throughout the school career. Certainly not treating, but being sensitive to what those issues are and making sure that they run the course. I think that's one of the things that we have seen, that through adolescence and through hormonal changes, maybe a child is on medication when they're an adolescent, and then they outgrow that particular prescription that they've been using for maybe ADHD or whatever. And so making sure that there's a continuation of access for the medication that individual needs is extremely important. But running that course and not saying, oh, this was just when they were in 7th grade, but making sure that there is a continuum of care. And again, that falls a lot of responsibility on parents to make sure that their child is continuing to get that care.
Good. Thank you, Nancy. Dominique.
I've spent a fair amount of time talking with teachers, talking with parents, talking with school administrators, and the issue of mental health has come up quite frequently. From their perspective, we certainly need more mental health care providers in our schools. There's a thought in regards to adolescent confidentiality. It's if there is a child that has some severe behavioral issues, who could be a danger to themselves or to others, it's something that can't necessarily be reported. So there are some thoughts about perhaps changing that. I would also agree with the concept of integrated care, primary care physicians, or healthcare providers being one of those first lines of defense, as it were, in helping to identify mental health conditions and certainly behavioral problems.
Thank you. Jovan.
Thank you. Definitely agree with a lot that's been said down the line in terms of providing it in our schools, providing it in our higher education institutions as well. But I think also what we need to do, because as the question was stated, continuing that treatment and maybe having that identifier early on in life, but continuing that treatment later in life is really putting much more focus and awareness around awareness and outreach. One bill that I've run numerous times is the Homeless Bill of Rights, which would actually decriminalize some of the ordinances that cities have passed that have basically made it illegal to be homeless, things like the camping ban in Denver. So often people are being punished for a situation that they're in that's oftentimes caused because of a mental illness. And I think instead of us criminalizing that, we should be using those resources towards outreach, towards awareness, finding out what kind of problems this person may be suffering from, and actually finding the solution as opposed to sweeping the problem under the door. So I definitely agree with my colleagues, but would take it that step further.
Right. Thank you. Janet.
I believe that if we have more funding for education, that funding would help us keep the counselors in the schools. We would also be able to have more essential professionals in the school to help us deal with mental health issues. So if we have more funding, we can have more counselors in the school, and that will help all of us identify those early signs of children who might be suffering from mental illness. And I also believe that that education should trickle all the way down. You know, you think about this. When kids get on the bus every day, that bus driver recognizes different traits with each child. Sometimes the bus driver is the person that those kids talk to. Also, the cafeteria workers, even the custodians in the school. So I'm not just talking about the teachers and the counselors. It needs to trickle all the way down to anyone who might have contact with kids. Because I was a former educator. And as a speech therapist, I had a lot to offer counselors and teachers of things I noticed about children who might be having problems. So I think it all goes back to more funding in the schools. And I think my time is up, so I can't tell you what else I was thinking, but I will.
We'll come back to you.
We'll
Thank
come
you,
back
Janet.
to me.
Mike.
Tough to come at the end here. I've touched on the idea of integration of care. I'll touch on it again. I think it's important, specifically integrating delivery of physical healthcare and mental health care in the schools. I think a couple of years ago, there was a pilot, I think first in the state in Jefferson County, Senator Keller might know better, where there was a state pilot program to actually sort of set up a clinic in a high school. I think that is especially important in lower income areas where issues that some of us take for granted, like time to go to the doctor, like transportation to the doctor's office, aren't as readily there for everybody. So having the care option in the school where the kids are anyway, and where the parents can come to, may help. School is a community hub. It is very often the largest physical building in an area, and I think that speaks to its social role and weight as well. If we do succeed in better care earlier, I think over the long run, it will be profoundly cheaper. It could be the difference between somebody graduating high school, getting into college, and living a productive life versus struggling in the shadows for a long time. And last point, destigmatization. Again, I think we've come a ways. I think we have a long way to go. Nobody feels any shame in having a broken leg or a cancer diagnosis, but there is shame that attaches to some of these conditions, and we have to push against that, and that includes how we talk about these issues with kids.
Good. Hang on to the mic. Mike, we're going to be coming back to you. Oh, Sebastian. I'll take it down to him.
I get no love.
I got to stay away from this hot spot. There you go.
Yeah, so Mike touched on it. The stigma. Who sees the children, you know, this is an issue that's not something that always pops up. Sometimes it happens in adolescence, like we say. Who sees our kids? I shouldn't say our kids. I don't have kids. I know I look like one, but I don't have kids. But who sees our kids more than anyone else, right? The parents. But they see them from maybe 7:30 to 8 in the morning, and then 6 and so on at night till the kids go to bed, and then on the weekends. The problem there is, like you said, the stigma. Parents don't want to accept that this is a problem. It's not a problem. Just like you said, a broken leg, cancer, anything like that, we don't view that as a problem. We view that as something that we need to fix. We view that as something that's out of people's control. Mental health is out of people's control. A young, child that has a mental health problem, that's not their fault. And we need to be able to say that so we can fix this problem. We need to start also developing our teachers to see this early signs of this, because they're the ones who spend the most time with their kids. And, we can start then. I don't want to over-medicate kids. We over-medicate kids too much as it is. But I do want to start the process early on so we can say, hey, if there's a problem, we've identified it, this is what we think. Make sure we explain it to the parents that it's okay, it's normal, it happens, and there's a way that the kid can live a productive life, and we create a solution. I'm going to go back to business. When there's a problem, we create a business plan, a strategy, whether it's a 30, 60, 90 or anything on those lines, and we map it out and we show people how to do it. And we need to show these parents on how to make sure that their kids are taken care of. And I will touch on it 100 times over. Get rid of this stigma. Mental health is not a problem. It's part of life, and we need to get parents to deal with it.
Thank you, Sebastian. So I heard a bit of a theme emerge in the answers to the gap question. And one of the themes was that our schools, our public schools, deserve to have a mental health care professional presence in one form or another, either through a well-trained teacher or a mental health professional at the school or within easy access to that school. In principle, how many of you agree with that principle? They all do. Good, thank you. I have an online question, and it's a good one. And you get to start, Mike. Would you sponsor legislation to require all educational institutions, K through postdoctoral in Colorado, to provide review by a licensed psychiatrist or psychologist before a student can be expelled or disciplined for a recurring behavior problem, possibly related to a mental illness? That's what you get online, folks.
Good question. I think my general answer to this kind of thing is, at panels like this, we, by necessity, speak somewhat in generalities. I need to read the black letter of any bill before I can come down one way or the other. I think more to the principles of it, we do need to be careful about expelling kids. We have a pendulum that goes back and forth on discipline. I think once you do that, you have set a child on a path from which it is hard to recover, and it's not going to benefit the child or the family or the community. So if the goal of the review, and I don't know the intent of the person who sent in the question, if the goal is to have a little bit of a safety net and maybe try to provide a second chance and establish that there is some mental condition going on which can be remedied with treatment, and maybe we can then integrate the child back into whether it's grade 3 or college, who knows. I would at least be sympathetic to that. Again, details are going to matter though.
Good. Who else would like to weigh in on that?
I support that we should be assessing kids as it relates to any mental behavior issues that they might have, but I don't think it should be tied to suspension. I think it should be tied to treatment and services. But not only should we be assessing if we see that kids have issues or they're in trauma, then we should be making sure that we have the adequate resources to align them to. So I know that in the state, we do have issues with referencing, identifying someone's problem, but then it just drops, the ball drops sometimes. And the circle of complete care is missed because there's an assessment, but there's no treatment, there's no follow-up. But I think we should be doing a better job of assessing kids that are experiencing trauma or behavioral issues, but we should not be tying it to suspension and discipline. We should be giving kids the resources and the support they need to handle whatever issues they have.
Good. Who else? Sebastian? Then Nancy.
The issue I would have with this and supporting this is I don't want this to be the boy that cried wolf. I was a fairly good kid in school. My brother, on the other hand, was not, and he would have looked for any excuse, and he would have ate this up. So I can't say I would support something like this. Like Mike said, I'd want to see, the ink on it. I'd like to see what exactly it entails. Possibly something like Rhonda said, it needs to be a full spectrum, not just one piece. But I just see this being an issue that kids would take advantage of, and just maybe I'm a little bit jaded because of my brother, but I just see this as an issue that I think some kids would take advantage of.
Okay. Nancy.
Thank you. I'll try to be really brief. I think a couple of things. One, most of our schools have processes, so it's not one and you're done, that you've made a mistake and that you are suspended or you are expelled. There is a process. There is oftentimes a lot of intercession going on between teachers and principals and psychologists, social workers, parents, and the child. Particularly when a child is in high school, that child is very much integrated in that meeting and in those conversations to make sure that they are well aware of what their behavior issues perhaps could lead to. And at the same time, we have many school-based clinics that are available. There's also something called first aid mental health. Am I saying that right? Mental health. Yeah, first aid 101, which again, I think is really upping the ante for the training for teachers, for principals, in terms of knowing and understanding. We are seeing more and more severe issues with children today. And again, I hope we can go back and talk about some of those root causes, because I think that is what is most alarming to me, that we have children in need, we have families in need, and we need to be comprehensive in the way that we have an outreach and be thorough.
Let's hand it down to Janet.
Nancy, Senator Todd hit the nail on the head, because there is a process in each school district and each school on how to handle these situations. And it would be really difficult to cry wolf and get by with it because of the processes that are set in place right now. Nancy addressed something about parents being involved in meetings when their kids are having problems. And last year, I ran a bill that was called the Parental Involvement Bill, to allow parents to leave work without fear of being, so they can go to their kids' activities and conferences at school. And unfortunately, there are so many unfortunate problems that happen, and the parent doesn't feel like they can leave work to go to talk to the principal or the counselors about their kids' problems. So if we could pass this bill next year, parental involvement, it would be a great addition to help the counselors and the teachers in the schools and the child, most importantly, help the child. So when we see these problems, they can be addressed.
Good. Let me ask you another online question. It has to do with proposed legislation. Would you support legislation that to require that people with brain disorders that result in criminal conduct be remanded to a medical facility for treatment and detention rather than to jail? Who would like to weigh in on that?
That's a big question. In some ways, I'm gonna probably be a little cautious in terms of a flat out yes, because my heart wants to say yes. I would want to see the details of the bill and what the evaluation process is of determining the person, or the extent of that person's injury or illness. But I do believe that if, and I said it earlier, if it's wrong to be punishing someone for circumstances that they have no control over. And so if there is some type of illness that's created the situation that they're in, or at least not helped in that situation being better, then what we need to be doing is trying to help them and trying to provide them with the services that they need. And I'm gonna try not to continue on, but looking for the, okay, here we go. I'll give it to Mo. Thanks.
I agree with Jovan. Of course, before giving out an outright yes, everything is dependent. But I think it's a great question, because we have a problem with over-incarceration. And a lot of these issues on people that are being incarcerated are because of mental illness in one way or the other. So it is something that I would definitely take a look at, and depending on how it's written, would support. I think the bottom line is that we need to stop using our jails as mental health facilities. That's not what they're there for.
Nancy.
If I can just jump in and just real quickly, I agree completely with what you just said. The problem is that we don't have facilities. We don't have places for people to go. So when there is a need, and I know we're going to talk about opiates as well, but when there is a need, there's no place for people to go. There are not enough beds available in Colorado and really nationwide. And we have seen that trend where more and more facilities have closed down, and people are not able to go to a safe place. That is something that, as a state, we have to address. We have to figure out what kinds of facilities can be opened to provide those safety nets for people.
Good. Anyone else? Down here to Mike.
So a few things. I think the way the question was phrased was brain disorders.
Mm-hmm.
I think here, as in anything else that any of us might do at the legislature, definitions matter. So one aspect of that would be to kind of sharpen what that means. But I think stepping back from the question for a minute, this isn't necessarily black or white. And I think probably in the way that our criminal justice system happens now, there is already room and discretion by which these questions can be evaluated. I mean, what I think the question is getting at is when we convict somebody of behavior that we deem to be criminal, it's not just because of what they did, it's the mental state, or what the law calls mens rea. With very few exceptions for strict liability offenses, that's an integral part of what we define as criminal. That goes back to English common law. And if there's serious brain injury at the structural level, I think that very much goes to the key element of mens rea in any criminal offense, and that ought to be sorted out in a court now. I think that discretion matters in our judicial system, beginning with charging. I mean, I think it's up to DAs who are looking at these things on the front end to try to assess the condition of an individual who's done something and understand why, if there is an underlying disorder. And I think these things vary widely across our judicial districts, but we have mental health diversionary courts, we have veterans trauma courts, we have drug courts in some but not all judicial districts. I think, you know, these alternative pathways of dealing with behavior that would otherwise be run through the traditional court system, I think are helping, and I would like to see more resources committed to these by the state.
Let me ask you all have expressed an appetite to get to the root causes of mental health challenges in our state. And a flashpoint for that is our inordinately high rate of teenage suicide. So with that as kind of the flashpoint, how would you get at addressing the root causes of mental illness that result in this case, a high rate of teen suicide in the state of Colorado? Mike, we can start with you. Do you want to take a breath? You want to hand the mic down to, we can come back to you.
Let's start with root causes.
Addressing root causes.
The question is, okay, say it again.
You've expressed an appetite on the panel to talk about the root causes of mental health challenges in our state. That is manifested by our high rate of teen suicide in the state of Colorado. How would you get at addressing the high rate of teen suicide in our state and reversing that trend?
Well, I mean,
Dominique.
I mean, I think that some of the answers have already very much been expressed. Clearly, we don't have enough funding, and therefore we're not helping enough people. Okay, we need more people to be trained in order to help identify people who are in crisis. That runs the gamut. We need to work on the stigmatism of mental health issues, so that people feel as though they can't get help, that it's safe to get help. We need to create those safe places. We need more treatment facilities. I mean, all of the things that we've talked about up here, I think lend themselves to getting at that root cause.
Good. Down to Rhonda and to Sebastian, who are anxious to address this issue.
This is a very serious issue when you talk about teens and suicide. And there was a study that was done by the state, and it indicated the number of days that a teenager is sad. And when you look at the numbers, it is alarming to see how many kids are walking around in our school with a sense of sadness, with a sense of depression. And you've heard this saying that goes, if you see something, say something. And so we have sometimes these kids walking around schools, and maybe someone might intervene, and then maybe someone didn't notice it. It's hard being a young person today, especially when you're bullied because of internet kind of things, or let's say there's issues at home. You went home, the lights weren't on. There's no food in the refrigerator. We have kids that are in trauma, they're in crisis, and we have an urgent responsibility to address it when we see it. And that does take funding, it does take resources, it does take training. The first aid, mental health counseling is a good first step. We just need to make sure that more teachers and administrators and cafeteria workers and bus drivers, anyone that touches and have access to those kids, if they see something, they need to provide, intervene, and get the type of services that are necessary.
Sebastian.
Thank you. See something, say something is definitely there. That's a big issue. It goes back to what I said before about making sure teachers are trained to identify these things. Making sure that this is going to sound rough. And the best way I can say is toughening up kids, right? Letting them know, hey, bullying is going to happen. Here's how you deal with it. This is what you do to come back. And you know what? Because somebody said something doesn't mean anything. Because we've got to start teaching kids to have, self-respect, to have self-esteem, to feel pride in themselves, feel pride in what they do. I know how tough it is. And I know a lot of us have been up here that know how tough it is when you don't have food on the table and stuff like that. I get it. I didn't grow up with anything. I grew up dirt poor. Friends of mine that were the same way, and I know the feelings that go through there. The one thing that I want to touch on here is I've heard the word funding a lot tonight. And this is where I'm going to break from a lot of people. We throw that word out pretty crazily because what we're doing is we're saying there's not enough funding. It's not about the dollar, it's about what we spend the dollar on. Let's make sure we're maximizing the dollar in every single department, not just for healthcare, every single department in the state. We need to make sure that we're looking over this, and you guys are all going to hate me. I don't think 120 days is enough for us to do that in session. I think we need to spend more time focusing on looking this over and seeing what we can do to maximize the dollar, because if it takes $10 for what we're saying, but it really only takes $6, we're wasting $4. So that's what I touch on that. But I think it goes back to making sure we identify early causes of this.
Good. Hang on to the microphone, Sebastian. Going to move on to your next pre-prepared question, and that deals with the opioid addiction rate in Colorado. As you may know, Colorado is facing an opioid addiction crisis and a lack of services for a variety of substance use disorders. This is having a significant impact on communities throughout the state. And this is where we're going to ask you to get a little bit personal. How has this affected your community where you live, and how do you plan on addressing the issue in your role as a state legislator? Sebastian.
It's not just opioids, it's all kinds of drugs. Drugs affect communities, they destroy communities. Here's the problem. We take drug users that need help. They have a problem, and what do? We throw them in jail. Well, you know what jails are? Jails are crime universities. They don't help drug users. We need to start helping these folks to, through rehabs and things like that. And that's where public funding is supposed to go. Rehabs, not prisons. We incarcerate way too many people, as I think all of us have said up here. We need to start saving those cells. Those cells are reserved, in my opinion, for the drug dealers who are out destroying not just one life, but the entire families. Because anybody who knows anybody who's had a family member that has abused drugs knows. They know, can't get PG-13 here. They know that this destroys lives. They know that this destroys families. They know that this tears apart at your very, very core. I've seen it happen in my family. I touched on my brother earlier. It was the same situation. Fortunately, he's better now. It's touched on a lot of my friends. I've got very good friends that I've seen lives torn apart from this. So we have to start helping drug users and making sure that we're going after the drug dealers, not the users.
Rhonda.
Yeah, this is another serious issue, and it's not just an issue that's happening in our city, in our metro areas. This is also an issue that is prominent in our rural communities. And basically, when you think about opiates, it's a pharmaceutical. So it's not just heroin. It's that kids and other adults are getting into their parents' drugs. And so what I see happening up on Colfax, people are selling pills that they get from somewhere. I don't know if they got it from a nurse or they got it from a nursing home, but there's access to pain medication. And when you think about how we're treating pain and we're giving folks, these prescriptions, whatever it is, oftentimes they're selling. Someone's getting access to it. And it's starting to create this addiction that people have to that medication. And so what we need to do, and I agree with Sebastian here, is that we need to make sure that we provide more treatment for those who are addicts, because what we have far too many people that are self-medicating, and they're using a variety of different drugs to self-medicate themselves for a variety of different issues. But it's the access to the pharmaceuticals that's just far too much. I think we're over prescribing medication, and then some people are using it or they're getting access to it, and it's causing this addiction that has to be addressed.
James.
I think you're probably going to hear a lot of same answers up here on this question. And I do think that it is a two-pronged approach that needs to be taken place. And I think it does touch upon the last question with teen suicide. I mean, opiates, as Rhonda pointed out, they're a painkiller. Why are our children being addicted to this painkiller? I believe that we need a study to really go down to the cause of what's causing not only the teen suicide, but also the high use of opiates, and particularly prescription drugs or unprescribed prescription drugs. The two-prong approach I think we need to do is we need to make sure that our law enforcement and public safety are properly funded, and give them all the tools and resources that they need to combat those the drug dealers and those breaking the law there. And then the treatment. We need to have stronger relationships with nonprofits and organizations that are helping to treat the community. My time's up.
He identifies that.
I think this is such an important question and such an important issue. I had the honor of serving on a Arapahoe House board, and during that time, it was a matter of really addressing and looking at how drugs affect across the board. It is not rich, it is not poor, it is not male, it is not female, it's not kids, it's not adults, it's across the board, age-wise, the whole thing. And so I think Rhonda hit it so well, and she said it's about dulling the senses. When someone is sad, how do they deal with that? Sadness is a part of life, and helping all of us know how to cope with all of those different angles of emotions that we deal with. I think that's why we're seeing in some cases many of our churches really doing more of an outreach for dealing with a safe place, an opportunity to come together and get some additional help. But I think along with that, the mental health first aid is huge in terms of having those open conversations. I firmly believe that educating and helping our youth particularly know and understand what consequences come from drug use. And, I think we have taken a swing on pendulum, and I know this is all about mental health, but I need to say it. I think we have stressed our children to the max. And I don't know whether we want to say it's all with testing or whether it is grow up fast, hurry up and read, 3-year-old can read. But I think that pace that we have contributed to has created an unsettling. Let children play, let them grow in their child development in a natural way. I think those are all contributing factors. So, I think the education, the health, public service announcements in terms of recognizing when you see someone that is zombie, there's a reason for that. Don't just walk away. Notify law enforcement, notify a teacher, but get help for that person. Because again, the end result of opiate overdose is higher than people who die in car accidents. This is severe. It is a crisis. I think we've heard that from our congressman and we've heard it from our president. It is a crisis proportion at this point.
Dominique.
I need some more education on this issue. And I would certainly look to all of you who have dealt with this in your lives, within your family's lives, or who are medical professionals or mental health professionals. My gut is this is an incredibly complex issue. And as it affects, as Representative Fields says, many rural communities. It's not just a city issue. It's socioeconomic levels, people across all spectrums, which tells me that there are no singular causes and no singular solutions. So I'm open to learning more in order to be more effective in trying to come up with some solutions.
Jovan.
Again, I think I'm probably going to say a lot of what's been said, but I do think it's a two-pronged attack. On one end, I think we've got to see why people are self-medicating, provide them with the mental health services and the resources to really get at that problem of the usage. I think we need to bring more education and awareness around this. We do a lot around tobacco use, around marijuana use. We spend a lot of state dollars on that. We need to also be focusing on some of the opioids. On the other side, and this is one of the rare times that you will hear me talk about increasing penalties for criminal activity, but this is one that's been a white-collar drug for a long time and has not been punished at the level of crack or some of the more illegal substances on the street. And because of that, it becomes a more attractive alternative for some drug dealers to go and sell, because they'll get basically, I mean, it won't be a slap on the wrist, but it's a far less punishment than going and selling a much harsher drug. So I think this is one of those instances where you would see me push for more parity on selling opioids as you would for selling more illegal substances.
Thank you. Janet.
Good point. There are resources out there. There are not enough resources, and I think we need to prioritize the resources, and that would help the situation. But I also want to give kudos and thanks to the Attorney General, because she is making sure that there are shots out there available